My name is Dr. Arthur Hartman. I am 63 years old. Did you know that in the time it will take for you to finish watching this video today, approximately 20 seniors will receive a devastating dementia diagnosis? That is one person every 66 seconds. But here is what should really terrify you. I spent 35 years in medicine without knowing something that changed everything when I finally discovered it. Let me tell you what happened. What if the root cause of this dementia is not just aging? What if the cause is right there in your own medicine cabinet? You have been constantly reassured that these pills are safe. They say they are routine. They say they are absolutely necessary for your health. I used to say the same thing to my own patients. But groundbreaking medical research is raising huge red flags. 99% of seniors have no idea that at least one medication they take every day could be physically shrinking the critical memory centers in their brains by more than 28% in less than 12 months. I need you to reflect on this for a moment. I know this sounds terrifying. I felt a knot in my stomach when I first read the data. Let me tell you something from the bottom of my heart. I have seen this happen many times in my practice. People trust their medications completely. They blindly assume that if a doctor with a degree prescribed them, they must be harmless. Meanwhile, the pharmaceutical industry has known about these devastating effects for decades. However, they continue to profit billions of dollars from the sale of the same medications that may be aggressively accelerating cognitive decline in millions of seniors across the country. In fact, a major 2023 study published in Neurology and Aging Research discovered that a specific class of medications increased the risk of dementia by 49% in seniors in just 2 years of regular use. That is not a small increase. It is nearly 1.5 times the normal risk. In this video, I am going to reveal the 9 most dangerous medications that trigger rapid memory loss and dementia. I have ranked them from the most ignored to the most harmful to the mind, and I want you to pay close attention to number 3 on this list. It is prescribed to millions of seniors for something that seems harmless, but it can literally shrink the key memory centers in your brain. You probably don't even realize this is happening to you right now. Before we dive deep into this crucial information, I want to hear from you. Let me know in the comments section below. What medications do you take every day? And have you ever experienced sudden mental confusion or unexplained forgetfulness right after starting a new prescription? We read all the comments. Do not stay silent about this. Speaking up could save your mind. Now, without further ado, let's start with number 9. Do not let the position of this medication at the end of the list fool you. It is in the medicine cabinet of almost every senior right now. It may be confusing your brain before you even feel the first symptom. Number 9 is diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that well-known pink pill that millions trust blindly. They use it to help them sleep, relieve seasonal allergies, or ease the symptoms of a cold. It is very cheap. It is sold without a prescription at any pharmacy. You probably have a bottle of it on your nightstand or in the bathroom cabinet right now. You might think you are just taking it to sleep better, but inside your brain, Benadryl actively interrupts your hippocampus. That is the delicate region responsible for the formation and storage of new memories. Benadryl belongs to a family of drugs called anticholinergics. They violently block a crucial neurotransmitter called acetylcholine. This is the vital chemical messenger that helps your brain create new memories and maintain mental agility throughout the day. As your brain ages, it becomes more dependent on every bit of acetylcholine it can produce. And when medications like Benadryl interfere with this delicate process, the results can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic medications regularly had a 54% higher risk of developing dementia compared to those who did not use them. That is a much higher risk, just for taking something that most people consider a harmless sleep aid. So, how to protect your precious memory? First and most importantly, avoid anything that contains diphenhydramine. Look at the label carefully, especially if it says PM, nighttime, or allergy relief. Usually these products are just Benadryl under another name. If you use it for allergies, there are newer, non-sedating options available, such as loratadine, commonly sold as Claritin. These newer antihistamines do not cross the blood-brain barrier. They are drastically safer for long-term use in seniors. Never stop a prescribed medication abruptly without medical guidance. But please do not assume that over-the-counter automatically means it is safe for the brain. The next one is a medication often promoted as harmless and gentle on the digestive system. However, it systematically interferes with the nutrients that your brain needs to stay agile. Number 8 is proton pump inhibitors, specifically Prilosec and Nexium. These medications belong to a class of drugs called proton pump inhibitors, or PPIs. These drugs are designed to severely reduce stomach acid production. They are frequently prescribed for heartburn, GERD, and acid reflux. I have seen many seniors use these medications for years, sometimes even decades. They continue using them because the burning symptoms return as soon as they try to stop. But what is rarely discussed with patients in a rushed 15-minute medical appointment is how PPIs interfere with the absorption of vitamin B12. B12 is a crucial nutrient. It protects brain tissue. It strongly supports memory, daily focus, and mood stability. In a groundbreaking 2016 study in JAMA Neurology, researchers examined more than 73,000 people aged 75 or older. They discovered that regular PPI users had a 44% increased risk of developing dementia compared to non-users. By excessively suppressing stomach acidity, PPIs interfere with the body's natural ability to absorb B12, magnesium, and calcium. These are essential minerals for neural transmission and brain cell signaling. Without adequate levels of these nutrients, delicate neurons struggle to function. This causes mental failures, deep confusion, and scary memory lapses that often look like the early signs of Alzheimer's disease. But the medical problem is deeper than simple nutrient loss. PPIs have been shown to increase levels of amyloid beta plaques in the physical brain. These are toxic proteins that actively interfere with the normal functioning of the brain. They are considered one of the main drivers of Alzheimer's disease progression. The good news is that there are safer alternatives. If you use a PPI daily, ask your doctor if you can reduce it with the help of H2 blockers like famotidine, sold under the brand name Pepcid. Although they are not perfect, H2 blockers are less likely to interfere with your cognitive function. The next medication is frequently prescribed for bladder control problems, but it may in fact be harming both your short-term memory and your emotional balance. Number 7 is bladder control medications, specifically oxybutynin. Oxybutynin, sold under the brand name Ditropan, is often prescribed to seniors with urinary incontinence or overactive bladder problems. Superficially, it seems like a practical and helpful solution. No one wants to deal with the embarrassment or inconvenience of frequent trips to the bathroom. But I didn't know, this medication completely blocks acetylcholine, the same vital brain chemical interrupted by Benadryl. And unlike some weaker anticholinergic medications, oxybutynin crosses the blood-brain barrier with great ease. It directly affects the memory regions in the hippocampus. This specific characteristic makes it particularly dangerous for seniors, especially in long-term use. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered that people over 65 who took strong anticholinergic medications, like oxybutynin, for more than a year, had a 49% higher risk of developing dementia. That is almost 1 in every 2 users. What worries me even more as a doctor is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They only know that the pill will help with the bladder. No one tells them that it may be actively accelerating their mental decline. Cognitive damage is often confused with normal aging. My patients often say they feel with a foggy mind. They forget medical appointments. They constantly lose everyday objects like keys. Suddenly, they have difficulty keeping up with simple conversations with their grandchildren. Rarely is this associated with the bladder medication, until significant damage has already occurred. If you are taking oxybutynin and have noticed any mental change, I promise you this is not just in your head. You absolutely do not have to continue with this specific drug to control your bladder. There are new medications available, such as mirabegron, sold as Myrbetriq. This medication works through a completely different mechanism. It showed significantly less impact on memory function. Number 6 is statins. Statins are among the most widely prescribed drugs in the world, especially for people over 60 years old. They aim to reduce cholesterol and drastically decrease the risk of heart attacks and strokes. Simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor, are the two most commonly prescribed versions. But that is exactly where the problem begins. Cholesterol is not just a concern for the heart, it is a brain necessity. Almost 60% of your human brain is composed of fat. Cholesterol has a fundamental role in the creation and maintenance of the myelin sheath. This is the thick lining that helps nerve signals travel smoothly and efficiently throughout the brain. By aggressively reducing your cholesterol with medications, you may also be depriving your brain of what it needs to function. In a 2023 study in Frontiers in Aging Neuroscience, researchers discovered that seniors over 70 who took statins for more than 3 years had a 26% higher risk of mild cognitive decline, and people who used high-dose statins showed even greater declines in their mental function. Even more alarming, some patients reported a sudden loss of memory. They described scary moments where they could not remember names of friends, recent conversations, or paths they traveled for years. One patient had to pull the car over on the road because he suddenly forgot how to get back home. He was terrified. It is vital to understand that not all statins affect the brain in the same way. Medications like pravastatin and rosuvastatin do not cross the blood-brain barrier easily. They are considered significantly less risky in terms of cognitive side effects. If you have been taking statins for years and notice mental confusion, forgetfulness, or an increase in confusion, it may be the time to talk to your doctor about reducing the dose or trying another strategy. Number 5 is benzodiazepines. Benzodiazepines such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are among the most prescribed in the United States for anxiety and sleep problems. They enhance GABA, the brain's natural calming chemical, reducing overstimulation. Initially, these medications seem like lifesavers. They calm racing thoughts, relieve panic attacks, and help with sleep. But over time, these drugs turn into something else. They become a dark trap. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years. They discovered that people who used benzodiazepines for more than 3 months had a 51% increase in the risk of developing Alzheimer's disease. The risk was even higher for long-acting benzodiazepines, such as diazepam, which remain in the body for a long time and accumulate in fatty tissues, including the brain. What occurs is a chemical sedation that gradually slows down neural activity throughout the brain. This means your brain literally stops learning new information as fast as it should. It becomes less flexible, less efficient, and more susceptible to deep confusion, scary memory lapses, and total lack of emotional sensitivity. Seniors who use benzodiazepines regularly frequently report feeling in a constant fog. They feel disconnected from reality and no longer recognize themselves. The worst is when they try to stop. Withdrawal symptoms, such as severe anxiety, violent agitation, and debilitating insomnia, can be unbearable, making the drug seem essential, when in reality, it is the source of the problem. If you have been using a benzodiazepine for more than a few weeks, do not stop suddenly. This can be dangerous and put your life at risk. Instead, work closely with a doctor to reduce the dose very gradually, over weeks or months. Number 4 is amitriptyline, sold as Elavil. Amitriptyline is an old tricyclic antidepressant which continues to be widely prescribed. Doctors use it for chronic pain, insomnia, and migraine prevention. Initially, it may seem like a versatile solution for many problems, but it is actually one of the most potent anticholinergic medications still widely used. It blocks acetylcholine powerfully, making cognitive effects with long-term use practically inevitable. A large 2015 study in JAMA Internal Medicine investigated more than 3,400 adults aged 65 or older. They discovered that those who consumed higher doses of anticholinergics, such as amitriptyline, over 10 years, had a 54% increase in the risk of dementia. What terrifies me is that most did not know the medication would harm their memory. They often took it for sleep or pain. Then, problems arose: short-term memory loss, difficulty finding words, and lack of concentration. Amitriptyline can cause invisible damage, even in low doses over several years, without clear symptoms at the beginning, disguising itself as aging, but which could have been avoided. Number 3 is paroxetine, sold as Paxil. Paroxetine is a common selective serotonin reuptake inhibitor, SSRI, for severe depression and anxiety. At first glance, it looks like an advanced antidepressant, but pharmaceutical companies rarely disclose the following. Paroxetine is the only SSRI with major anticholinergic properties, differentiating it from other SSRIs, such as sertraline and escitalopram. In a broad 2021 review, researchers analyzed senior patients on SSRIs. They found that those who took paroxetine had an alarming decline in short-term memory, verbal recall, and attention in the first year. In addition, seniors who used paroxetine presented a 30% higher risk of signs of early cognitive impairment compared to other antidepressants. Ironically, although it is prescribed to improve mood and decrease anxiety, paroxetine, in the long term, affects mental clarity and emotional regulation. The American Geriatric Society inserted paroxetine in the Beers criteria, indicating health risks for seniors. Number 2 is antipsychotics. This is deeply alarming, as many do not know they are taking strong antipsychotics. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed for schizophrenia and bipolar disorder. Today, they are frequently prescribed off-label for common sleep problems, mild agitation, or dementia behavior changes. This involves the inappropriate use of these drugs in nursing homes, serving as chemical restraints. The impact is terrible. A 2022 study showed that seniors on antipsychotics for behavior had a 71% higher risk of accelerated cognitive decline in 12 months. The risk increases even without a prior history of dementia. In addition, they raise the risk of stroke, sudden death, sedation, fractures, and permanent hospitalization. The mechanism involves the reduction of dopamine, which severely affects thinking, memory, and emotion, leaving the person looking like a zombie. Families feel the loss of their loved ones' minds. The question is this really necessary, or does it serve convenience? The number 1 is anticholinergic polypharmacy. This is the hidden danger. The most dangerous situation for the senior is not just one drug, but rather the combination of medications with anticholinergic properties. The term is anticholinergic polypharmacy. For example, a senior who takes Benadryl for sleep, oxybutynin for the bladder, and amitriptyline for pain. Isolated, the damage can be subtle, but combined, the anticholinergic burden is gigantic. A 2022 analysis followed more than 280,000 seniors and concluded that the high anticholinergic load increased the risk of dementia in 10 years by 120%. The vast majority did not know they took anticholinergic medications. By blocking acetylcholine on various fronts, the brain physically deteriorates. Without stimulation, neurons wither, leading to a state very similar to Alzheimer's. To solve this, review your medication with your doctor or pharmacist. Ask for a complete evaluation, considering prescription remedies, over-the-counter drugs, and supplements. The most encouraging thing is, drug-induced dementia can be reversible. Withdrawing these medications frequently improves clarity, energy, and memory. The brain can recover if the harmful factors are removed. Anticholinergic polypharmacy is preventable, making it the number 1 hidden threat. I want to hear from you. Which medications of the 9 listed do you take? Have you felt brain fog, forgetfulness, or personality changes with a new medication? Talk to your doctor. Share your experiences in the comments. Your story can be useful. Leave a like and subscribe to Vital After 60. I am Dr. Arthur Hartman. Take care of yourself. Do you want me to explain how to ask for a review of your medication on your next visit?